Pennsylvania's Medicaid program provides insurance coverage for vital healthcare services to some of Pennsylvania's most vulnerable citizens, the elderly, the disabled, and children. The majority of these individuals, like Bill Watts of Allentown, are unable to work and cannot obtain insurance coverage on their own. Bill was born with Duchenne muscular dystrophy. He's 43 years old and lives at the Raker Center of Good Shepherd Home and Rehabilitation Hospital in Allentown.
I need use of a motor wheelchair, as you can see that I'm sitting in, and I also have a trach and a ventilator, and I have a pacemaker and defibrillator for my heart, which is affected by the MD, and I have extensive respiratory issues. Well, if I wasn't here at Good Shepherd Raker Center, I probably wouldn't have survived, and I probably wouldn't have lived as long as I've lived.
Pennsylvania's disabled and elderly make up 35% of all Medicaid enrollment in Pennsylvania, but account for nearly 70% of the spending. In Pennsylvania, Medicaid finances the care of 65% of all elderly residents being cared for in nursing homes. Pennsylvania's Medicaid program also covers 31% of all children and funds nearly half of all births, providing necessary care for very sick infants. Medicaid covers 2.2 million individuals in Pennsylvania, and that number continues to grow. These individuals are your friends and neighbors in communities across the state. It's estimated that Pennsylvania's Medicaid rolls may grow by as much as 800,000 under the Affordable Care Act. More patients, more care. Pennsylvania's hospitals, along with their related physician offices and clinics, provide most of the acute care services for people with Medicaid coverage. And for each person that receives care, hospitals actually lose money.
Last fiscal year, we had a gap of almost $10.5 million in the cost of care compared to what we were reimbursed. And that is up over 18% from the previous year. So we continue to see that number grow each and every year.
Hospitals lose money every time they provide care to a patient with Medicaid coverage. That's why it's vitally important that the amount of money hospitals are paid to care for patients with Medicaid is not cut. If payments are cut, hospitals will be forced to eliminate programs and services that benefit all Pennsylvanians.
The reduction in payments, cutting the medical assistance payments, also affects every single person within the community. It's not just insurance specific. If a service gets cut from a hospital, it's cut. It's not that you make it available for people who have Medicare or private insurance. If a decision is made to eliminate a service, it's eliminated for all payers.
If we didn't have the medical assistance reimbursement for our inpatient and outpatient volumes, we would probably have to start to begin to close services and reduce services that are offered. You know, we run a 24-hour, 7-day-a-week emergency room. We would have to look at that.
When Medicaid payments are cut, and if they're cut more, it will have a definite negative impact on the whole community.
You need to, in the midst of the pressures of cutting money, you have to realize that it's impacting persons, and we can't really afford to really take too much more away.